Welcome to this short video demonstrating what our upper GI training model can be used for. The following slides and videos show it in use for hemostasis, dilation and peg insertion.
This first video is demonstrating an esophageal varix being banded. A standard bander is placed over a gastroscope. The gastroscope is then placed over the simulated varix and a band placed. Each esophageal varix can take several bands, therefore maximizing training opportunities. This next video shows that we're in the stomach and we're in the J maneuver, and visualized is a simulated gastric varix. An injection needle has been passed through the accessory channel of the gastroscope. Liquid is injected into the varix and a subtle color change can be seen to occur on injection. We're now in the bottom half of the simulation model, which has 3 ports for various positions for ulcers. Here we can see a bleeding simulated gastric ulcer, and an injection technique can be practiced where you can inject quadrantically around the ulcer or directly into the simulated bleeding vessel. Here we are still at the same ulcer port and the same bleeding vessel. We are going to be deploying a through the scope clip across the ulcer. Each ulcer can have multiple clips deployed, thereby maximizing practice and training of clip placement for ulcer bleeds.
Here we have the last video demonstrating hemostasis techniques. We have an over the scope clip placed on the end of a gastroscope. We are at the same gastric ulcer port and we are placing the over the scope clip over the bleeding point. When we're happy that we're in the correct position, we apply suction, and then just like a bander, we deploy the over the scope clip, and thereby we can practice various clip placements. In addition to hemostasis training, the training model can be used to practice esophageal dilation. Here we can see an esophageal dilator being passed through a stricture within the esophagus and dilated accordingly. The upper GI model can also be used for peg tube insertion, and here a peg insert is placed at the top of the stomach. From inside of the stomach, finger indentation can be clearly seen. The peg insert has imitation skin which can be infiltrated with mimicked lignocaine. The skin insert is then incised with a scalpel. Here we can see the peg needle and introducer being placed through the peg insert and an endoscopic view. Here we see the thread being placed through the peg introducer and an endoscopic view obtained, and the thread is being caught with a snare. The thread is removed with the gastroscope outside of the training model. Then the peg tube is tied onto the end of the thread for the second operator to slowly pull back through the esophagus and the stomach. The thread is then pulled through the peg introducer, thereby pulling the tip of the peg tube out of the model as shown. And finally, here is the endoscopic view of the peg being in place. So that's a short demonstration of what can be trained or practiced with our upper GI model. Thank you for watching, and I hope you good luck in your endeavours for therapeutic gastroscopy. Best wishes from Endotrainer.